Hi, everyone. Welcome to Side Project, our foray into the fun that is middle age that we're all dealing with in different stages and different ways these days. I'm here with my very good friend, Ruthie. Hi, Ruthie.
Hi, I'm happy to be here today too. And as always, we're talking about ways we can, maximize our health, be more proactive with our health so we can stay stronger for longer. And today we are talking about gastro health. I've actually been looking forward to this topic for a long time. Partially because, I've had gastro issues my whole life, so we can get into that. But gastro health feels like it's a little bit taboo to talk about. Right? In the same sense that we've been talking about perimenopause a little bit, and that feels very taboo. And gastro health is kind of the same way, don't you think?
Yeah, people don't like talking about shitting their pants. But let's be clear, everyone shits their pants at one point or another. Yes, Ruthie. Yeah. You go in the Peace Corps, and then you talk to me about shitting your pants, because trust me, I did it so many times in the Peace Corps. I was like, I'm kind of immune to it now. So that when my midlife friends are bringing this up, I'm like, yeah, it's okay. It's going to be okay. Nevertheless, let's be clear. We all have problems with our stomach, right? One point or another. You drank too much. You didn't eat enough. You ate too much. You ate the wrong thing. Something weird went in and you feel terrible. I mean, it happens to everyone just living our lives. But like menopause and like other topics, this one in particular, people feel uncomfortable talking about because they're embarrassed. Which is funny because, like, if you're honest, doesn't everyone laugh when someone farts or when someone makes a fart joke? I don't know anyone that doesn't laugh at that. But like, yet we can't quite get to a place where we talk about this honestly.
That's
right?
True. That's true. So yeah, let's get into it. So today we have with us Dr. Bincy Abraham. She is a gastroenterologist and professor who specializes in IBD. And I want to be clear, that's inflammatory bowel disease, which is different than IBS, which is more common. That's irritable bowel syndrome, I believe. So those two things are very different. I think one is chronic and one is more, just you ate something bad, kind of what Layla was talking about, I think. Well, that's word. I'm getting ahead sideways. Anyway, so Dr. Abraham specializes in IBD, which is like an umbrella that includes things like ulcerative colitis and Crohn's disease. And who better is there to answer some of our crazy questions about digestive health? I am sure this episode is going to get down and dirty, and I am here for it. Welcome, Dr. Abraham.
Thanks, Ruthie. Thanks, Layla. I'm so excited to be here with you and get down and dirty with you as well.
This is like your life. Like, you live this. Like, did you, when you were young, you were like, I'm doing it. I'm going to be a gastroenterologist. Like, that was, how do you choose that as a specialty?
Well, I always like to say it's a dirty job, but someone's got to do it.
I knew we picked the right person for this topic.
I basically done. Yeah. Okay. All right. Let's dig in. So Ruthie wrote so many questions for this podcast. I mean, Ruthie always writes a lot of questions for our podcast, but this one, she was on a tear. But the first one started, which was a great one, which is like, what is the deal with our microbiome, right? Like, what's going on with all these different types of supplements around, like, eating this or eating that or drinking a whole bunch of kombucha or however you pronounce that. That's the way my mom said it. My mom called it kombucha. So I grew up in Berkeley, lest me remember, because I've been drinking this my whole life. Like, so I say it wrong. But nevertheless, like, eating tons of yogurt, all this immunity microbiome stuff. What's going on? What's really happening?
Actually, very interesting fact. Actually, maybe I should ask you the question, or the listeners, like, do you know how much bacteria we have in our body?
A lot.
No idea.
Good answer. Actually, we're actually in a space where we have 10 times more bacteria than we have human cells. So essentially, we're just like the host for the microbiome, essentially. And
that doesn't even feel like it's possible.
I know.
Cram all that. I mean, it must be absolutely cells are microscopic. And so this must be like microscopic.
Yeah, well, that's what we call it, microbiome, right? They're small, tiny. You can't really see those bugs in a regular naked human eye. And it's very interesting. Like, so that whole concept of we are what we eat, like, that's exactly true. And so the healthier we eat, our microbiomes are healthier. The unhealthier foods that we eat, our microbiomes end up being unhealthy for us. And there's a huge interaction in our microbiome and what's going on in our cell layer in the GI tract and our immune cells. So you talked about my specialties and taking care of patients that have inflammatory bowel disease. We know that having a good microbiome can potentially prevent the disease, or when the question is, what came first, the chicken or the egg? Was it the bad microbiome that caused the inflammation, or was it the inflammation that messed up the microbiome? I think it's probably a combination of both. There's such huge interplay between the cells, the mucosal layer of our GI tract, and the bacteria that's there, and they're always talking to each other as well. So there's a lot to discuss there, and I won't go into all the nitty gritty, but the bottom line is that what we eat, if it's healthy, we generally tend to have a healthier microbiome. The unhealthy foods, and we can go into details of what's unhealthy or not, and diet as well, but that leads to a messed up microbiome essentially.
And so what are some of the signs if your microbiome is not quite right? What are some of the signs that we should be looking for?
Yeah, so sometimes there may not be any signs at all. You may just feel normal until something bad happens years down the line, like inflammatory bowel disease, or others can have some early signs that you eat something and your microbiomes aren't the usual. You can get bloating, or sometimes you can get a change in your bowel habits, diarrhea, or maybe constipation. So it can really vary based on what your normal microbiome is, how much has changed, what your diet is. So all that interaction. So it can really vary.
Okay.
Okay, I've kind of an off the cuff question. How many times are you supposed to go to the bathroom a day? Like have a bowel movement?
Exactly 2.2 times. No, I'm just kidding.
Yeah. I was like, wow, that's very specific.
Exactly 8:05. You should have had it. No,
sometimes I have friends that don't go to the bathroom for like 2 days, and I'm like, what's happening? I mean, they might be traveling or something. That's not my experience, just for the record.
There's no set rule. So that's why I joke about like, no, please don't take that to heart. Like you shouldn't have exactly 2 bowel movements per day or 1 per day, etc. It can, again, all vary. It all depends on your microbiome status, your genetics, what your motility of the GI tract is, what you're eating, how much fiber intake you have, your hydration, the amount of activity. Are you really mobile or running around, or are you laying in bed all day? Like all those factors play a role. So on average, like going even 2 to 3 times a day can actually be normal in some patients, or some just in the population in general, I should say. In others, going 2-3 times a week may be normal for them, as long as the bowel movements are soft and not hard, you're not struggling to go, or you're not having loose, watery stool. So the consistency, as long as it's not in a liquidy form or really hard pebbles, if it's somewhere in between for the most part, you're not struggling to go, is not the number of times you go per day or per week. It's more of, is it normal for you?
Okay. That makes sense. So we often talk a lot about perimenopause and menopause and the ways that our bodies are changing currently as we age. How does aging affect your gastro health and your systems?
Yeah. So you brought up menopause or perimenopause, and that's when a lot of our hormones, especially in females, are changing. And any changes in hormones can lead to gut issues, essentially. But what we see overall is that the older we get, things tend to slow down. No big surprise, right? So the older we get, our GI tract tends to slow down. So we tend in general to get more constipated as we get older compared to when we were younger. That's why, our grandparents are like, oh, prune juice and prunes. That's what keeps me consistent. And it's true, because there's a lot of good fiber in the prunes, and the sugars that help, is not as well absorbed, so you can actually go to the bathroom.
The Metamucil ads.
Metamucil ads.
Do you remember those Metamucil ads from the 1980s?
You don't see 18-year-olds on those ads. You see the 70, 80-year-olds on those ads. Yeah,
exactly.
Yeah. So in general, we tend to slow down as we get older, but it also depends on your activity level, fiber intake, and genetics, and all the things I talked about earlier as well.
What do you think about taking fiber pills or eating Metamucil or drinking it or however, like I take fiber pills every day. I'm no lie,
Okay.
I do.
Okay.
Like,
So I
what's your
think I know a lot about your microbiome.
Layla's an open book. I think that's
well, isn't that the point?
This is great. I love it. I'm so glad you're able to openly talk about your fiber intake.
Sure, why not? Why
Yeah,
not?
fiber, great question regarding fiber. So fiber is great for your GI tract, especially for your colon cells. Our colon cells love fiber. In general, we've seen studies that help show that it helps in reducing colon cancer risk. There's an entity called diverticulosis where you can have outpouchings of your colon. That can happen at increased risk if you're on a low fiber diet. So fiber can, help prevent those structural changes from happening as well. So fiber in general is good for you. Now, there's different types of fiber. There's soluble and insoluble fiber. So I kind of think it as, that whole saying of eating an apple a day keeps the doctor away. At least an apple a day may keep the GI doctor away, at least from constipation issues and all of that. In the sense that if you think about the apple, there's the skin, right? Think of that as the insoluble fiber. You have to like chew it up and it's rough and all of that. And then the apple actually has soluble fiber, which is a pectin that's in the inside, the meat of the apple, essentially. So that's two different types of fibers. So some people, if let's say have a patient with Crohn's disease and it has a narrowing or stricture in their, intestine, they may not be able to tolerate that insoluble fiber because it's roughage that has to get through a narrowed area. In those cases, I recommend more of the soluble fibers for them. They still get the benefit of that fiber, but they can at least tolerate it and food's not going to get stuck and they're not end up in, getting in the hospital with the bowel obstruction or anything like that. So so fiber in general is good for you. What you can tolerate, it's what the best to do. Of course, in general, we recommend getting about 30 to 35 grams of fiber in your diet every day. And in our regular American diet, sometimes it's tough to get that. However, if you don't get it in your regular diet with, fruits, vegetables, whole grains, then it's recommended that you take some fiber supplements, Layla, like you're doing, just to keep our GI tract healthy and happy and also more regular as well.
I mean,
So
is supplement both? Sorry, Ruthie.
Yeah, no, that was my question.
And you're taking the pills. So that's good, right?
Yeah, you can take
too much fiber.
You can always do too much of anything, right? Yeah. In general, but I think the bigger issue is we're getting too little fiber. And if you're really, and you have to work at taking more fiber, right? It's not like you can eat, 20 oranges or, 20 bowls of broccoli, but you can easily eat 20 Snickers bars or, 20 chocolate chip cookies more easily, right? So I think I'm not really too worried about people taking too much fiber. The issue would be if they were on more fiber and they would get like an obstruction if they have some structural damage, like I mentioned, like in patients with Crohn's disease or some narrowing from prior surgery or something like that. But other than that, you almost can't, do too much fiber, essentially.
Well, speaking of supplements, let's talk about probiotics for a minute and prebiotics. I'm not even sure what prebiotics are, but it's a term I hear a lot. But probiotics is more common, I think. And everybody's like, oh, you've got to take a probiotic for your stomach. It's so helpful to keep your microbiome healthy. Is that true? Or is this just like something, again, another marketing ploy to get us all taking more supplements than we really need to?
So yes and no is the answer. Well, let me just first clarify. Probiotics are the actual good bacteria, such as lactobacillus, bifidobacter. Those are things that are, you find in yogurt. Prebiotics are the foods that help nurture the good bacteria. So things like inulin, onions, garlic, things that help grow the good bacteria, essentially. So it's good to have both, essentially, in your diet. Now, as far as its role in GI health, of course, it's always beneficial to take it in the natural form, eating yogurt, eating the fruits, vegetables, fibers, onions, things like that. Now, you can take supplements if you feel like it will help you. And I can tell you there's a lot of different studies, but it's so hard to study probiotics because each of our microbiome is so different, right? And the probiotic supplements have different formulations of it as well. And also, anything that you take in, keep in mind that whatever you swallow, it has to get through this very acidic environment in your stomach. Your stomach is making all this acid. Whatever you take in has to survive that to get to your small intestine, to get to your colon, to provide all the benefit the probiotics will, give to you. So if we look at overall health, if you're getting probiotics naturally, if you don't have any GI issues, that's the best way to do it. Now, if you have specific issues like irritable bowel syndrome, different studies show that probiotics can help with some of the symptoms like bloating or pain or diarrhea. So if it helps you, great, continue taking it. If you tried some probiotics and it didn't help you, then stop taking it. There's no point in continuing something that's not helping you. Now, more specifically, if you're focusing on, let's say someone who has inflammatory bowel disease, there actually has been studies looking at treating or using probiotics in Crohn's disease, ulcerative colitis. But I can't say that in the Crohn's disease trials, the probiotics haven't really mounted to be very beneficial, especially if you look at randomized controlled trials. Those are the scientific way to see if one thing works better than another, right? So in Crohn's disease, the evidence has really been very positive. So I generally tell my Crohn's patients, like, if it helps you, great, take it. But if it's not helping you, don't waste your money on the supplements. Sure, eat your yogurt, eat the healthy stuff to, continue your overall general health. In ulcerative colitis, most of the studies are in general to help with prevention of a flare, to kind of keep you at baseline for the most part. Is not really useful if you have severe active inflammation because your microbiome is already so messed up that adding a little yogurt or probiotics not going to really help that much. Now, we have the most evidence actually in patients that have pouchitis or have J pouches. And if you're not familiar with that, yeah, exactly. So that the J pouch is where, if let's say you had a patient with a lot of inflammation, their colon, they had to get their entire colon removed, and to get you back, instead of having a stoma, ostomy back on your abdomen, the surgeons will make a little pouch. It's called a J shape because it's made out of the small intestine. They have a little reservoir that J, the bottom part of the J essentially, and they connect it, to where your rectum used to be, the anal canal, so you can have like more normal, bowel movements rather than going through an ostomy bag. So sometimes when you have this J pouch, you can actually get pouchitis or inflammation of that pouch. Oh. And we think it's because, the stool, the small bowel is really not used to a lot of bacteria where the colon is, but because you have this pouch and there's a bacteria kind of stagnant in there, it can irritate and cause inflammation. And actually using probiotics can help with preventing pouchitis, or even as adjunct treatment while we're treating the pouchitis flare with some antibiotics as well. So that's the best evidence we have with using probiotics in the GI tract.
Is that the evolution of the colostomy bag?
No, so the colostomy or ileostomy bag is just a bag that's, it's to help collect stool if you're diverted away from your rectum, the anal canal. But this pouch is actually internalized. So, you may have had a bag in like as a temporary thing while you're getting the inflammation under control, and the surgeon goes back in and reconnects you back to your anal canal, so you can have a more like a normal bowel.
Normal situation. Yeah. Wow.
So these are all very scary sounding things. So in terms of being a little bit more proactive, what are 3 things that you recommend to anybody, just your casual Jane here and there, ways we can take care of our digestive health, so we can be stronger for longer?
Yeah. So in general, that all the stuff I talked about could be very specific to that individual.
Sure.
In general, regardless of age. I think we can all improve our gut health by just being really good to ourselves. The stuff that our mom said, eat our vegetables, eating a healthy diet, right? If we increase our fiber intake, fruits, vegetables, those can keep our microbiome happy and our gut happy. It improves our glucose regulation. We're not eating sweets all the time. The fiber helps slow down how we digest the foods in our stomachs. We're not overeating. As I mentioned, like you can't overeat on, bowls of broccoli, but you can eat a bunch of chocolate chip cookies, right? Easily. So it helps with that. And actually that healthy diet, we've actually even found in studies that can prevent inflammatory bowel disease. So it may be even a preventive measurement as well. It can also keep our bowel movements more consistent as well. So you're not going one way or the other. In fact, fiber can help with treating diarrhea. It can also help with treating constipation. So it kind of gives your bowel movements a bit more regular as well. Second thing I would say would be, besides actually proactively eating a healthy diet, is avoiding processed foods, the things that are in packages where you can't pronounce half the ingredients. It's really a simple way to look at it. So if you are going, it's like, this is some, chemistry label that you're like, I remember trying to do that in chemistry class, but I'm eating that right now. That's the wrong way to go. So avoiding those foods. Now, doesn't mean we're all human. Like I still like to eat my bag of chips once in a while. Doesn't mean you can't have it once in a while, but that shouldn't be your daily routine of your diet, essentially. So avoiding the processed foods. Another way to think about it is when you go to the grocery store, start shopping on the outside, right? Where there's the fresh fruits and vegetables, the bakery where there's freshly made bread, not the packaged with the processed stuff that's to keep it fresh for months and months, right? The meats, the dairy, that's actually fresh, like it's real food, nuts, things like that. Avoid or minimize what you eat or take or buy from the aisles where everything is in boxes and have preservatives in there. That can also keep your gut happy and healthy and the microbiome healthy as well. So that's like another simple way to think about eating, improving your gastric health as well. And the third thing is there are non-diet stuff that can improve your GI tract and keep your microbiome happy. And that includes getting enough sleep and exercise, staying hydrated. Actually, there's been we looked at studies showing that lack of sleep can affect your microbiome. And of course, when you don't get enough sleep, you feel miserable anyway. Who cares what you eat or don't eat? You have brain fog. You don't feel good. You don't have as much energy. So simple things like that can help, and exercise also can help improve your microbiome as well.
So you talked a lot about diet, and I want to segue over into the standard American diet, our favorite, the SAD as we call it. So the standard American diet obviously is a ton of bread and meat and dairy. So on a scale of 1 to 10, how bad is the standard American diet for our gastro health?
Oh, that's a big question. So in general, standard American diet's probably maybe 10 being the worst, 10, I would say. Yeah. It just depends on, how much of that you take in. Now, bread is not necessarily bad for you. Meat is not necessarily bad for you. Dairy is not necessarily bad for you. It's just a matter of how much and how much is it processed, right? So one thing, if you go to and I won't name, chains, etc. If you go to a, food chain and what do you call it? The
fast food
chain, right? And you grab the stuff that, and you probably saw those TV shows looking at those hamburgers can last for 5 years and looks the same as the first day. That's not real food, right? So that would be really bad. But let's say you make your burgers at home. You had grass-fed beef and you got fresh stuff with good spices and you load it with lots of tomatoes and lettuce and, like good cheese and a bread maybe from sourdough or freshly made, then that actually may not be so bad for you compared to what's processed, right? So there's some components of it that we need to, look into more details about. And, and then meat. So fish is considered a meat product. Fish is overall generally healthier than red meats. Chicken, depending on, how much fat is in there and all of that. And the other thing we don't think about is we lump meats in general, but we also need to think about where did they come from? Is it, grass fed versus they were getting, or chickens that were getting cornmeal all the time. The way their meats form, their muscles and everything forms, we're eating that. So what we eat is what our meats ate as well. So that can also play a role. So you can eat good meats, you can eat bad meats as well. Yeah.
Gotcha.
So yeah, I think you have to keep those in mind. You can probably eat a happy, sad diet, or you can eat a really sad diet too. Yeah.
Gotcha.
Yeah, I mean, it really sounds like the answer is getting rid of processed foods. I mean, just being more conscious about what we put into our bodies, which I think, most of us, who are listening here try to do that anyway, but we're not perfect. So it's just a nice reminder that, all these things really affect us, all the systems inside that we don't necessarily think about all the time.
Yeah.
Stuff's happening inside us.
Right. And one thing, we talked about red meat and dairy, but actually sugars are one of the biggest killers, essentially, I should say, because if you think about the processed foods, we thought about low fat diet. Okay, great. That was a big thing back then. But we realized that we do need fats and we need good fats. So in a lot of the low fat processed stuff, they added a lot of sugars to make sure it tasted good, but sugars actually turn into fat in our bodies if we're not metabolizing it. And that's been a big issue. And our new epidemic, essentially, besides the whole obesity epidemic, is metabolic associated steatosis, or fatty liver, essentially, what used to be called. And what happens is that the liver loves sugar. And if you're eating only sugar, then it gets absorbed quickly. And if you're not using it up, you're not running a marathon, you're going to be eating and sitting at your desk all day. What happens to all that sugar? It turns into fat. And, we think about getting fat as underneath our skin, or bellies blow up, or thighs, or hips, or buttocks, etc. But actually the most dangerous fat is the one that is stored in our organs. And if you have fat stored in our liver and you have fatty liver there, you actually can cause damage to that liver over time, where it can cause fibrosis or scarring, and it can even cause liver failure. And now more and more of our patients getting liver transplants are due to the metabolic disease, not from hepatitis or even alcohol. It's really because of this metabolic dysfunction, because we're eating more than we're actually utilizing, and eating more sugars, and that's getting processed into, or changed into, fat and stored as fat.
That's really interesting.
It's really interesting.
So you mentioned the liver. So one thing that Layla and I like to ask all of our guests is, why can't we drink wine anymore? And all of our experts are like, yeah, you just can't. And they don't really say, they're like, I don't know, it just doesn't work for us anymore. We can't sleep. And we're like, yeah, we know. But what's your take on this? And I know alcohol has a lot of complex, opinions on it these days as well. But, scientifically, how come when women hit perimenopause, the way we process alcohol changes?
Wait a minute. Did you say we can't have wine anymore?
No, not that we can't, but if I have, a glass or two of wine now, I'll wake up at 2:00 in the morning, being wide awake, or
I might be over. You just said we can't have wine anymore. Life is over.
Headline news. No, we still enjoy our wine. Trust me. So, but you kind of have to decide. Am I willing to chance it tonight, or am I gonna be okay with being a little bit more groggy in the morning than I used to be?
Yeah. So wine in general. I know you probably have heard, having a glass of red wine can be good for your heart health back in the day, like decades ago. You probably heard those slogans or so, but we actually found that wine, or any type of alcohol, is really not good for us in general. We've seen increased risk of cardiovascular disease and even cancers with increased alcohol intake as well. Now, it doesn't mean, like I said, even with the processed foods, if we avoid everything that's bad for you in life, well, what's the point of life, right? But again, going back to, this shouldn't be your norm. Sure, have a drink to celebrate a birthday or an anniversary or a wedding or whatever, whatever celebration in life. Otherwise, what is there to life in general? But but if the key thing is, I'm not even saying like moderation, it's like it should be a rarity. Why is that? Because we already know alcohol is not good for you in the sense that it can increase your risk of cancers. It can also affect your, mental ability. It can also make you wake up at 2 a.m. because it's dehydrating. It actually is more of a stimulant. You might think that, oh, I'm going to drink a glass of wine to go to bed. Like, yeah, you may initially go to bed, but you'll wake up all stimulated while your body's trying to break down the alcohol as well. And some populations, like genetically, some people have this deficiency in this alcohol dehydrogenase, which is an enzyme that helps break it down, where they can't tolerate wine at all. They get flushing or palpitations and things like that. So they're kind of protected. They already know what's going to mess up their body, so they'll avoid it at all costs. But for the rest of us, just need to keep in mind that alcohol in general is not good for you because of how we metabolize it, that it's a stimulant. It can affect your brain capacity essentially. And the other thing is alcohol. If you think about it, if you remember back in chemistry, the OL is also a sugar. And guess what sugars do in the body? The liver goes, oh, let me store you as fat. And we also see fatty liver if you drink too much alcohol as well. And that can also cause damage to the liver and fibrosis and scarring and liver failure as well. So there's numerous reasons where we shouldn't drink any type of alcohol as a norm.
So maybe that's why. So like we could process it in our 20s and 30s, and now maybe it's our gastro system that has changed, and that's why we can't process it in our body. Like I don't drink a ton of wine anymore. I might, once or twice a week maybe, but is that it? Is it because I think for me maybe it is the sugar, because I have problems with sugar anyway. So is it that? Because it's converting the sugar in my liver, and that's why I have trouble with it?
Well, yeah, and I think that's part of it. As we get older, our metabolism slows down. We're not metabolizing things as normally, so it stays in our system a bit longer. And when you're 18, you're super metabolizing. You're growing. You're doing this and that. We can tolerate a lot more.
You're just wasted on the young. You're just wasted on the young.
Lack of sleep, running around, muscle tone, all of. So I think it's very multifactorial.
Yeah. Okay.
Yeah. Okay. I have one question on that. So I know we're not supposed to drink. I know you're a doctor. I know. But if we are going to drink, is there something better to like? Should we drink beer or wine or booze or a spritzer?
Right? That's a good question.
Yeah. So, I mean, you can also definitely look at the alcohol percentage, right? So that's something. So the lower the alcohol percentage in whatever drink you're getting, the better,
Yes, but mentally, I want the higher alcohol percentage. Yes, with the medium, do we meet in the middle? Is that what we do here? Like, right. I'm drinking to get the higher alcohol percentage.
Right. Well, so you have to look into what you also like, right? So although there was one study that said that drinking like champagne or like the bubbly drinks, there was a reduced risk of sudden death. Why? Don't ask me. I'm like, oh, I can have a champagne. I'm not going to die today if I drink.
That sounds like a big pile of BS to me, but I haven't looked at the science.
I know this is, so anyway, that's just one study, and I don't know how well validated this is and all of that. But so key is lowest percentage of alcohol, but you also have to keep in mind that the volume can differ, right? So like whiskey, for example, you need a few this to an ounce, and that would be more alcohol than a glass of entire container of a spritzer. So just really look at the percentage alcohol content. But the other thing is you also don't want to drink something you hate. Like if you are not a whiskey or bourbon type of person, well, it would be the opposite. If you're not a champagne kind of person or a spritzer kind of person, avoid it altogether and have your little glass of, whiskey once in a blue moon, than to drink more of something else that you do not prefer. The other dangerous thing is actually the mixed drinks with the lots of sugary syrups and all of that. You're getting double
No
double.
more Red Bull and vodka, Dr. Abraham? Well, I mean, I was like,
Oh.
that was my jam. That was my jam.
In our 20s, yeah.
My 20s, my 30s. I went well into my 40s.
It
with Red
was
Bull and
the
vodka.
worst when I was living in San Francisco in my 20s, and that's what everybody wanted to drink. And I was working at this advertising agency and making peanuts, and they would charge you for like the glass of vodka and the Red Bull. And so it's like, there's my paycheck.
Oh my gosh.
Yeah.
Let's not even get to Red Bull. That's another story.
Yeah.
like double caffeination, and I don't even want to know what was going on in our bodies.
It was really fun. I'll tell you that, Dr. Abraham. I had a great time drinking Red Bull.
Yeah, my 20s were super
Awesome.
fun.
I'm not unhappy at the moment, but yes, I'm not drinking that anymore in my 50s. Not to worry.
Yeah.
Well, so what about caffeine? How does your gastro system handle caffeine?
Yeah, so caffeine is a stimulant, as you know. There you go. Actually, so there's a couple of things with the caffeine. So caffeine is a stimulant, so it can actually even improve the motility of your GI tract to a certain extent. So sometimes we get this like Starbucks phenomenon where you drink, some caffeinated beverage, and you kind of have to go to the bathroom because it's stimulating the motility of your GI tract. So that in general, if you're more constipated, the caffeine can actually help you in that aspect. Again, not as some strong, super duper, prescription medication, but the caffeine is more of a stimulant, the GI tract, and increases the motility. So you can actually help in that aspect. The other thing we know about caffeine, or at least we know about like black coffee, for example, is that it can help prevent or can be beneficial to your liver. If you have fatty liver, now you can't add all the sugars and the milk and this and that, like drinking black coffee, that's been shown to help with fatty liver, metabolic associated liver disease.
Oh, that's great news.
Yeah.
I love that because I recently given up dairy. And so I drink black coffee now. So I feel like I'm doing double duty. Woo!
Yeah. So as long as you don't do, double fist with black coffee in one hand and a wine glass in the other.
Black coffee with my white wine chaser.
Yeah. What not to do, right?
Wow.
Yeah, it can be beneficial. Now, keep in mind that, if you have heart palpitations or you don't tolerate caffeine really well, that you shouldn't, obviously do this Red Bull thing or, combination of that. But the other thing is if you drink caffeine too late in the day, it can also affect your sleep. And that's not good for your overall health either, including your gut health, right? So each person has their own time cutoff. For me, it's like 4 p.m. And if I finish my coffee or any caffeinated beverages by 4 p.m., I can sleep well at night. But if it goes to 5, then I'm struggling to go to bed at midnight thinking, why am I still up? And I'm thinking, oh, I finished my cappuccino at 5 p.m. because I left it on my desk all day and didn't get a chance to get to it until I was done in clinic or something like that. And that can affect your sleep. So keep that in mind. So just some precautions to the caffeine of not drinking it too late. And also if you get palpitations or any side effects from that, obviously not to continue using more of that.
Amazing.
Okay, now I'm going to dive right in.
Oh.
Let's talk about colonoscopies.
Wow.
I'm super excited. Colonoscopies are like the worst. I mean, why did they change the recommended age from 50 to 45, right? And I have heard that it's because of the increase in colon cancers. So they've got to try to start with early detection and stuff. Can you tell us, can you just let us know why are colonoscopies so important? What are they telling you? What can you tell about a person's system from a colonoscopy?
Yes, colonoscopy, one of my favorite subjects.
So you actually do colonoscopies?
I do colonoscopies.
And when you're younger, you're like, I want to be a colonoscopy doctor when I grow up.
Again, like I said, it's a dirty job, but someone's got to do it, So I'm glad you brought this up because I think we really need to increase colon cancer awareness in general population. You're absolutely right. It used to be age 50. If you don't have any other risk factors or any family history, that we started everyone at age 50, starting with doing colonoscopies. And if things look good, then if you didn't have any polyps, then we'll repeat in 10 years, etc. Now we reduced that age start to 45 because we're starting to see more and more younger patients with colon cancer way earlier than we'd saw in before. So we and colonoscopies are used to prevent cancer, right? That's the main goal of colon cancer screening with colonoscopies in the general population. Now, granted, if there's family history, someone who, in your family that, especially immediate family or even next gen, next of kin in that sense, if there's someone with a younger, history of colon cancer, even colon polyps, we generally want to make sure that that person, the family member, gets screened 10 years prior to that diagnosis in the family. So let's say mom was diagnosed with colon cancer at age 50, then you would start at age 40 for, screening, right? So someone was diagnosed at age 40, then, in your immediate family, you start at age 30. But if there was no family history, we start at age 45 now. And who knows, if we continue with our sad diet, we may need start doing screening colonoscopies at age 40 or 35. And that's just, more work for us to do, but it's really, truly sad. I mean, I think the cancer risk has a lot to do with their diet, right? Going back to what we're taking in, the low fiber, the more processed foods, the increasing risk of all these changes in our DNA, where it's causing mutations. And really, colon cancer occurs in the general population where these mutations happen, then you start growing these cells. It becomes these what we call polyps. There are different types of polyps: adenomatous, tubulovillous, tubular adenomas, villous adenomas, tubular adenoma. And the more villous it gets, and generally becomes closer to the dysplasia or the cancer. And they're serrated, and there's different types of polyps. Without getting into all those nitty gritty, the key is that with the colonoscopy, if we see a polyp, an abnormal growth, kind of looks like nodules, and you look at different forms. It could be flat, it could be raised, it could be in a little peduncle. We see it, we can take it out. And once we remove it during the colonoscopy, those cells are no longer there to grow into cancer. So we've essentially prevented colon cancer in someone. We do a colonoscopy, we found polyps, and we've taken those polyps out. So that's how it can be very beneficial. So it's a very important tool. Sure, it's one of those that people don't like to talk about or even discuss or even get done because, oh my gosh, I have to get a scope, and it's, someone's going to put a scope into my bottom and look in there, etc. But really the hardest part is taking that bowel prep. That's where you're at home drinking the stuff to clear out your colon. Right. But think of it as, I like to kind of say, well, how can we make this a positive thing? Just think you're a Hollywood celebrity and you're getting a high colonic before the Oscars or something, and you're going to lose like 2 pounds, to feel really good the next day. So think of the bright side. But that's the most important part, because we want to make sure your prep is really good. So when we go in to take a look, we can see the colon clearly. We're not like trying to clean up some left residual stool here or this mucus here and this and that. So that's really important, but that's really the hardest part. Once you come in that next day to get your procedure done, we're going to get you an IV. You're going to be asleep. You're going to have like this really nice, one of the best naps you've had all day that year, whatever, the 10 years, etc. And we get to do all the work to look and, find polyps and take those things out and prevent colon cancer in you. I really think we need to change that stigma of, oh, what is this colonoscopy? I don't want to go through with it, because it's really life-changing, preventing cancer. So I'm so glad you brought it up. And really, we just should change that stigma of, oh, I don't want to get this colonoscopy done, or, oh, I don't know what it's all about. And it's a procedure. It's an invasive procedure, and that you have to come into a hospital or an outpatient center to get this done, but actually a relatively safe procedure. The risk of things like bleeding or perforation is actually extremely, extremely low. And the benefit, it's far outweighs those potential risks. And if those things do happen, we can also treat then and there as well. It's only very rarely that you end up need to have some sort of major surgery, for those things. Wow. And we really are good about stopping a procedure if we feel like it's too dangerous, to continue as well. So I'm so glad you brought this up. I think we really need to improve this colon cancer awareness.
It's clearly cleaning the pipes.
Yeah.
You know, like when you have those guys come and look in the pipes with those scopes, like when you're getting, my pipes always have roots in them from the trees.
Yes.
So
So we're
it's
human.
sort of like you're cleaning the pipes, you know.
I didn't mind the procedure at all. It was great. I didn't mind the bathroom stuff ahead of time either. The only thing I didn't like was the taste of the drink. I thought that was like I took everything in me to choke that down. But then the resulting stuff, it actually felt great to kind of get everything cleaned out. Like you said, I kind of like that aspect of it.
They should put a whole bunch of sugar in the drink. Then
I can't have that. But okay, so what about the like poop in a box methods?
Well, that's what I do. My doctor won't. I ask every time. I'm like, colonoscopies? Like, no, do a myth kit and send it in, and then I'll let you know.
Okay, well, we should always offer the option of all of those, right? I would never tell a patient like you should only get a colonoscopy or you should only do the poop in the box method. It should be an option. So I told you about the colonoscopy, so you know all the details about that. We're able to see and treat right then and there. Yes, you have to do the bowel prep and all of that. So you kind of know the pros and cons to it. And if everything looks normal, then you don't have to repeat that colonoscopy until 10 years later, unless of course there's your higher risk, there's family history. We might do it in 5 years. Or if we found polyps, we'll have you come back sooner because we know that you may tend to grow more, and that can be dependent on how big the polyps were, what type of polyps are. We have like a little set of guidelines. You may come back in 7 years, 5 years, 3 years, a year, just depending on what we find. Now, there are other options, right? So there's like the Cologuard testing where it actually checks your DNA in the blood and stool that's coming out to see if there's any changes there that could predict that you may actually have polyps or colon cancer. So if you do that type of test and if they find it to be positive, then you're going to get referred to get a colonoscopy done to see why it became positive. So it's just a test. It's not, let me rephrase that. It's not just a test. This test doesn't tell us if you have a polyp or cancer. It gives a really good idea that if it's positive, there's something is going on. So you need to go get that colonoscopy done. If you're negative, there's always a chance that we could miss something, like a small polyp. But the thing is with those Cologuard testing, you do it every 3 years. So you're not doing it 10 years. So if it comes back negative and maybe you were growing something small, but it was so small to detect, in 3 years, you'll have a repeat one. So if that polyp grew, then it should pick it up at that, next one. So, and again, nothing is foolproof. There's always a chance we could miss something. Even with the colonoscopy, if you had a poor prep or it was a polyp that was hiding behind a fold, there's always a chance we could miss something. Similarly with the poop in the box testing, essentially, we may miss something because maybe you didn't detect that DNA or so as well.
That makes sense.
That's super helpful.
That makes sense.
Yeah.
Well, I feel like you've given us a lot of really great information on how we can be more proactive with our gastro health. And that's about all the time we have today. So Dr. Abraham, thank you so much for joining us to get down and dirty and talk about our digestive health. We learned so much, and anybody can find a recap of this conversation on our website at sideprojecthq.com. You can learn more about Dr. Abraham and her practice at houstonmethodist.org. I hear it's very hard to find female gastroenterologists, females who do colonoscopies. At least that's what I'm told. So
yeah, that's true. All mine are men now that I think about that.
Yeah. So anyway, thank you.